Rene, you've been a patient since the beginning of January, so like you just said, this is your 60-day anniversary of being a patient in the office.
Correct, yeah.
That's great. And as we explained to you before, I like doing testimonials on a patient who's been here only a short time because patients who are considering, or people who are considering our care, it's nice for them to see that in a short time you can get a lot of improvement, and that really describes you. Now, you came to us with mixed connective tissue disorder, possibly scleroderma. They had a really tough time giving you a diagnosis. Raynaud's disease. You had arthritis, gastritis problems, fatigue, stomach trouble, joint pain, cold hands, and
everything.
Really everything. And you started a program with us, and why don't you just tell us how you're doing?
I'm doing great. No fatigue, no inflammation. The Raynaud's is, I would say, like 75% gone. No gastritis. Since coming here, I've lost 13 pounds in 60 days, all with eating real food.
Right, so we're not starving you.
No, not at all. Real food, supplements, shakes, and, feeling really great. Just whole new person.
No, it's amazing.
It's really great.
So, the Raynaud's is really interesting because we see that a lot, and it's really debilitating. And how is it affecting you? How was it affecting you?
Oh, how was it affecting me? It was debilitating. It was just constant attacks. I mean, like every half hour, just having attacks. And you lose all blood. I lost all blood circulation to my fingertips. So, and I work at a computer job, and I'm a bookkeeper. So, I couldn't do my job.
Sure.
Yeah, I was actually, thinking I would have to go out in disability. That's where I was at when I came here.
Right.
And my rheumatologist was like, well, there's really nothing I could do for you. So that was where I was at, and that's why
I think that's a great point that you bring up, is the patients we see have often been told there's nothing that can be done for them, live with the problem or take this medication. And the first thing I would share with anyone who's watching this video is that's not true. There's a lot you can do to help yourself, and this is what you've been finding out. So the Raynaud's, would you say it's 80% improved?
Oh, definitely. I mean, I've been out shoveling snow for the past month, and I do use the hot hands with it, but even with that wasn't necessarily working, and now I can go out and shovel snow and be active. I do still have bouts, like, if I'm touching something cold, or now
well, remember, it's 60 days, we haven't even really gotten, through to everything we want to accomplish, so, whether you're going to ever get 100% results or not, we don't know, but we're certainly striving towards that.
Exactly.
And what most importantly is we're trying to teach you a lifestyle that's going to carry over for the rest of your life, so you know what to do, you know how to stay healthy. Right now you're using us, for coaching and chiropractic care and how to implement the supplements, but we're trying to teach you a lifestyle. And I think that's a great value in what we do for our patients. How do you find the office, the staff?
Oh, well, I love the staff. I mean, Nancy and Martha are great, always very welcoming, and you and Dr. Sinagra. I kind of feel like you guys are family. I really do. I feel that.
We feel that way with our patients, so I'm glad you notice that and feel that way. I mean,
most definitely.
We try and have an office that runs smoothly, and patients don't have to wait too long, and they get the care and the time they need. And I think that's also a big difference in our offices, the time we spend with patients that they don't often get in other offices. Some visits are quicker, but sometimes you have problems. You ask us questions, and I think we answer them as best as we can. Not that we're perfect.
And I've always asked questions. I know that sometimes I kind of like...
You like questions.
I do like questions. I do like questions. I like information.
When you started the program, were you skeptical?
No, I was not. I was not a skeptical person because I'm going to school for nutrition. And I knew it starts in the gut, the healing. So I was seeking, doctors that also believe that. And that's where I was going. So when I found you, the whole introduction and what you stand for is I believed in myself. So I in that sense, I wasn't skeptical, and that's why I just really kind of just gave myself over, to the process, and really did not cheat and did everything I needed.
You've been a great patient.
I did everything that.
So as far as you mentioned the stomach, so as far as the gastritis and the stomach problems you're having, those seem to be pretty much.
Yeah, they're great. It's gone. So I'm on the cleanse part now. So during the cleanse, I guess in the beginning, everything you try to get used to.
And getting
but
used to.
That went away, and I really don't have the gastritis anymore. Now and then, I still take my HCl, and now and then. But I don't even, sometimes I forget because I don't need it.
Right.
But I know.
And it's not something you have to stay on forever. It's just
Right.
to give you that digestive aid while we're healing your body. So, for someone with an autoimmune problem, someone with digestive problems, fatigue issues, even if they've been told that they can't get help, what would your recommendation be?
Well, there is help, and you can do it without medicine, and you can do it metabolically, just through eating real food. It's really diet and lifestyle, and I've been letting everybody know about this practice, and that it's great, and you don't have to suffer. You don't need to. There's ways of healing. Your body can, if you get out of yourself's way, your body will heal itself.
Absolutely.
That's really the
You've
message.
been a great patient, and we really appreciate you sharing. Thank you so much.
Thank you. You're welcome. Thank you.